This is Heart Attack, the ultimate guide to prevent reverse heart disease and stroke, written by Dr. Christy Conson, read by Jesse Gross. Introduction. We tend to take our heart for granted until something goes wrong with it. Our heart is the most important muscle in the body, beating more than 100,000 times a day to send oxygen-rich blood to all the tissues and cells in the body in order to keep them healthy. As we age, however, there are a number of things that can compromise our cardiovascular health, that is the health of our heart and blood vessels. Some of these issues may be hereditary, but the good news is that most of them are actually lifestyle related. By modifying your lifestyle, you can offset any genetic issues and do your best to boost your heart health. In this guide, we will be presenting you with a 21-day challenge to help you improve your heart health in all natural ways. Many of the suggested activities are actually easy to implement. Others will be a case of you starting out and then needing to follow through. While you will find 21 suggestions, it is important to set your own goals. Determine what is most important for you to tackle in relation to your heart health based on your age, family history, overall condition at the moment, and your most important numbers from your doctors. Let's look first at why heart health is so important, and then at the numbers you need to know in order to set goals for your heart health challenge. Chapter 1. Why heart health is so important. Heart health should be important for obvious reasons, but many people focus so much on cancer prevention that they forget heart disease is the #1 killer worldwide for both men and women. In the United States, heart health is considered to be a man's problem. While it is true that more than 390,000 men have heart attacks each year, it is also true that more than 271,000 women experience them. Studies have also shown that women have less favorable outcomes than men because they do not always suffer the same dramatic symptoms as a man having a heart attack. A heart attack is triggered by a severe or complete cutting off of the blood supply to the heart via one of the main coronary arteries. Those with coronary heart disease will often experience a narrowing, stenosis of the arteries due to cholesterol, which forms what is called plaque. The plaque buildup on the blood vessel wall leads to hardening of the arteries. The plaque will either cause the vessel to become so narrow that the tissue of the heart starts to become starved of oxygen, or a part of the plaque will break off to form a clot, which can then get jammed in a narrowed artery and cut off the blood flow completely. If this happens, any heart tissue served by that blocked artery will die, and if enough damage is done, it can lead to severe consequences. Since time is of the essence when it comes to stopping a heart attack in its track, an untreated heart attack will continue to cause damage to the heart, resulting in tissue death and perhaps even actual death. Statistics show that up to 50% of women who have a heart attack die within the first year. Studies have also shown that by the time she is in her 80s, a woman's risk of heart attack becomes equal and then greater than that of a man. Heart disease kills more men and women each year than the top 10 causes of cancer combined. Even the most lethal of cancers.
Sample complete. Ready to continue?